Our priorities are to provide a solid educational experience along with scholarly activity, as well as different things that residents can use lifelong. So we want to teach them to be self-directed learners, lifelong learners. We want to emphasize residents as teachers, and we want them to be able to practice wherever they choose after graduation and feel well prepared to do so. We actually allow them to choose electives, to customize some experiences. If they let us know, for example, that they're interested in a particular diagnosis or patient population, we allow them to see those patients in an outpatient setting and an inpatient setting and set up electives. So residents really have the opportunity to customize experiences and really foster their own personal interests.
The level of autonomy in our program is an upward slope. By the end of intern year, you feel pretty capable of handling most basic stuff on your own and even some of the more challenging stuff. Second year, which is what Jade's doing right now, you see patients and then you may check in at the end of the week, typically with a supervisor, but in the moment you're the one making those decisions on interacting with patients. And then in third year, when you return back to more inpatient settings, you're essentially treated as a junior attending. It escalates appropriately throughout the years.
A typical day for me as a current PGY2 is me coming into clinic, kind of reviewing the patients that I have on my schedule for the day, updating myself on what we talked about at their last visit, medication changes and things like that. And then just seeing those patients throughout the day, kind of back to back, writing notes in between as I have time. There are certainly some challenging moments throughout the day. But I think that one of the things that helps me get through is having those patients who, I see getting better and who, value our relationship, and I can see that I'm making a difference.
One of the first things that is unique about our program is the diversity of our clinical sites. So our residents rotate within the State Department of Mental Health, the Veterans Administration, different Prisma Health locations, the Department of Corrections, and other community institutions. And so they really get to see everything and go a lot of different places, see systems and patients, and I think that's really enriching for them.
We actually go to Bryan Psychiatric Hospital, Kirkland Correctional Facility. So we see a lot of different places. There's a lot of different settings to treat patients in. I think that's really important to see how other health systems are operating.
Another thing that we have also is we have really good fellowships that really enrich our general training, and that's in child and adolescent psychiatry, forensic psychiatry, and geriatric psychiatry. We have a longitudinal wellness program for the residents. We have lots of opportunities for scholarly activity, and we have really good didactics, really good teachers as well.
When I was selecting a residency program, I think the most important factor for me was feeling like the people that I train with are like family. Now that I am a resident, I can say that I experience that camaraderie every day, from walking into my colleague's office and having a chat, walking to lunch together, to texting day and night, to hanging out with each other on the weekends. If I could offer one piece of advice to applicants this year, then I would say put your best self forward, but remember to be yourself, because ultimately you want to feel like the program accepts you for who you are.